As we age, certain health challenges become more prevalent, and among them, nighttime leg cramps stand out as a particularly disruptive and common problem. Known medically as nocturnal muscle cramps, these involuntary contractions can strike subtly, often catching seniors off guard. They wake us from restful sleep, interrupt daily routines, and, over time, can diminish overall quality of life. Understanding how to prevent these episodes is essential, and one of the most effective approaches involves examining and modifying key habits that contribute to their occurrence. By addressing these areas, seniors can significantly reduce the frequency and severity of leg cramps, leading to more restful sleep, greater comfort, and increased independence. Leg cramps are complex phenomena rooted in changes within our muscles, nerves, and circulatory systems that naturally occur with age. Muscles contain nerves that send signals to contract or relax, maintaining our movements and posture. As we get older, these nerves can become more excitable, and muscles can weaken due to a condition known as sarcopenia, the aggravated loss of muscle mass. Meanwhile, circulation often slows down, and electrolyte balances, the minerals that regulate muscle function, may become disrupted. All these factors create a fragile environment where muscles are more prone to sudden spasms, especially during periods of rest or decreased activity. Recognizing these underlying physiological shifts underscores the importance of adjusting daily routines and habits to support muscular health and prevent cramping. One primary habit that contributes to leg cramps is dietary intake, specifically the consumption of excessive salt and processed foods. Many seniors have developed dietary patterns that favor convenience or reflect lifelong preferences. Commonly, this includes foods high in sodium such as canned soups, salted snacks, fast foods, and prepackaged meals. While salt plays an important role in maintaining fluid and electrolyte balance, consuming too much disrupts this harmony. Excessive sodium causes the body to retain fluids, leading to dehydration and electrolyte imbalances, particularly in minerals like potassium, calcium, and magnesium that are vital for normal muscle activity. When these minerals become imbalanced, muscles are more likely to contract involuntarily, resulting in cramps. Reducing salt intake is an important step. Focus instead on a diet rich in naturally occurring minerals essential for muscle health. Incorporate plenty of leafy greens such as spinach and kale, which are high in magnesium and potassium. Nuts, seeds, and legumes, such as beans and lentils, are excellent sources of magnesium. Whole grains, including brown rice and oatmeal, supply both magnesium and potassium, supporting muscle relaxation and preventing spasms. Proper hydration prevents dehydration-related electrolyte imbalances. Aim to drink at least 8 glasses of water daily, distributing your intake evenly throughout the day. Increase water consumption during hot weather or after physical activities. For added mineral support, consider beverages like coconut water or specially formulated electrolyte drinks, but consult your healthcare provider before making significant changes, especially if you have existing health conditions. Hydration is often overlooked, but plays a crucial role in preventing cramps. Many seniors restrict fluid intake to manage urinary incontinence or because of a diminished sense of thirst, unintentionally risking dehydration. Dehydration reduces blood volume, which hampers circulation and skews electrolyte levels, conditions conducive to muscle spasms. To prevent this, establish a consistent hydration routine. Sip water steadily throughout the day, especially before bedtime, to ensure your muscles have enough fluids to function properly. Carry a water bottle with you during daily activities and set reminders to hydrate. If you experience dry mouth or dark urine, these are signs that your hydration needs attention. Remember, older adults often feel less thirsty even when dehydrated, so proactive hydration is essential for muscle health and cramp prevention. Physical activity patterns also significantly influence the likelihood of leg cramps. Spending long hours in one position, such as sitting during travel or work, reduces blood flow to the muscles, causing stiffness and decreased flexibility. When you suddenly stretch or move after prolonged inactivity, cramps can occur. Conversely, engaging in sudden, intense activity without adequate warm-up can fatigue muscles and increase their excitability, triggering spasms. Therefore, maintaining a balanced, moderate activity routine is key. Gentle stretching exercises before bed or after periods of sitting can help keep muscles flexible. Incorporate daily walks, light, strength training, or gentle yoga, which promote healthy circulation and muscle elasticity. These activities not only lessen cramps, but also improve balance, strength, and overall mobility, reducing the risk of falls and injuries. Developing a consistent exercise routine tailored to your ability encourages better circulation and more relaxed muscles, which are less prone to sudden contractions. Another habit to reassess involves overexertion and neglecting the body's signals of fatigue. Many seniors push themselves too hard without proper preparation or rest. Activities like gardening, long walks, or household chores are valuable for maintaining activity levels, but can become problematic if performed excessively or without warming up muscles. Chronic overuse strains muscles, depletes energy reserves, and elevates nerve excitability, setting the stage for cramps. Similarly, sleeping in awkward positions or maintaining poor posture can put undue strain on leg muscles, leading to spasms during rest. To mitigate these risks, practice moderation and listen carefully to your body's signals. Warm up muscles with gentle stretching before engaging in physical activity. Rest when feeling fatigued, and avoid repetitive motions that cause discomfort. Use supportive footwear for walking and standing, and consider gentle massage or relaxation techniques. Restorative practices help muscles recover, remain flexible, and resist involuntary contractions, especially overnight. Medications can also influence the occurrence of leg cramps, particularly those that alter electrolyte levels. Many seniors take medications such as diuretics, statins, certain antidepressants, or blood pressure drugs. Diuretics, often prescribed for high blood pressure, are notorious for depleting potassium and magnesium, essential minerals for muscle function. When levels of these minerals drop below optimal, muscles become hyperexcitable and prone to cramping. Some medications impair circulation or nerve signaling, further increasing the likelihood of spasms. It's essential to be proactive about this issue. Regular blood tests should be part of your healthcare routine to monitor electrolyte levels, especially if you are on medications that affect minerals. Always discuss any concerns or side effects with your doctor, and do not alter medication dosages without professional guidance. In some cases, your healthcare provider can recommend supplements, such as potassium or magnesium, or adjust medications to minimize adverse effects. Avoid self-medicating or increasing supplements without medical advice, as imbalances can be dangerous. Addressing these 5 habits: excess salt consumption, insufficient hydration, irregular physical activity, overexertion, and medication effects can significantly influence muscle health and the frequency of leg cramps. Each change may seem small, but together, they forge a powerful strategy for reducing discomfort and enhancing quality of life. It's important to recognize that your behaviors directly impact your muscle function, especially as your body becomes more vulnerable to age-related changes. Making gradual, consistent adjustments is more sustainable and effective than attempting drastic overhauls. For example, reducing salt intake gradually while increasing your intake of magnesium-rich foods can be a manageable starting point. Establishing a routine of drinking water regularly, incorporating gentle stretches into your day, and reviewing medications with your healthcare provider create a comprehensive approach to cramp prevention. Implementing these habits yields benefits beyond cramp reduction. Improved hydration, balanced nutrition, appropriate activity, and medication management contribute to better circulation, stronger muscles, enhanced mobility, and a more restful sleep. These improvements foster greater independence and confidence in everyday activities. Imagine sleeping peacefully through the night without sudden jabs of pain, or walking briskly without hesitation. It's empowering to realize that small, deliberate choices can lead to meaningful change. Taking control of your lifestyle in these ways nurtures your muscles and your overall well-being, helping you reclaim comfort and vitality in your later years. The journey toward fewer leg cramps begins with awareness and simple adjustments. Simple, daily acts: drinking enough water, adding mineral-rich foods to your diet, stretching gently, listening to your body's signals, and collaborating with your healthcare team add up over time. These steps do not require drastic overhauls, but rather mindful, consistent efforts that build sustainable habits. Visualize a life where nighttime cramps are a rare occurrence, where aging does not mean constant discomfort, and where each day is lived with mobility and confidence. Regaining control over your muscle health is within your reach, and it starts with small, meaningful changes. There's no quick fix or miracle cure for leg cramps, but there is a proven path forward. Knowledge and routine are your most powerful tools. As you adopt healthier habits, you reinforce your body's resilience and create a foundation for ongoing well-being. Imagine waking up feeling refreshed, with muscles that feel relaxed rather than tense, ready to face your day with vitality. Picture yourself enjoying leisurely walks, gardening, or playing with grandchildren without fear of sudden spasms. This is not just wishful thinking, but a realistic goal achievable through consistent, mindful behavior changes. Your body is your greatest asset, and nurturing it can restore comfort, improve your independence, and elevate your quality of life. Every small step you take toward healthier habits counts. This might mean setting reminders to hydrate, choosing nutrient-dense foods, incorporating a gentle stretching routine into your evening, or discussing medication effects with your doctor. Over time, these actions strengthen your muscles, improve circulation, and reduce the likelihood of cramps. Remember that change doesn't happen overnight. It is a gradual process supported by patience and persistence. Celebrate each positive shift as a victory: each glass of water, each stretch, Each nutritious meal contributes to your overall goal, a life lived with less pain, more mobility, and greater independence. The power to prevent leg cramps lies in your hands. By making informed decisions and adopting supportive habits, you can diminish discomfort and enhance your well-being. Listening carefully to your body's signals, choosing nourishing foods, staying active in a gentle and consistent manner, and working with your healthcare providers creates a comprehensive approach that protects your muscles and your quality of life. As you commit to these changes, you will likely experience not just relief from cramps, but a renewed sense of vitality and confidence. Your legs, once prone to sudden, painful spasms, can become sources of strength and resilience. With patience, dedication, and awareness, you can redefine your health and enjoy each day to its fullest. This journey toward better muscle health and cramp prevention is ongoing and personal. It's about creating a lifestyle that respects your body's needs and supports its natural aging process. Small adjustments, repeated consistently, lead to remarkable results. The goal is to achieve restful nights, energetic days, and the freedom that comes with mobility and comfort. Your commitment today sets the stage for a future where cramps are fewer, sleep is deeper, and your independence is preserved. Trust in the process, be patient with yourself, and remember that each step forward is a step toward a healthier, more comfortable life. You have the tools, the knowledge, and the capacity to take control starting now, because every choice counts, and the benefits are well worth the effort.